Welcome, everyone. We're going to get started in just 1 minute. Let everybody sign in. Great. Why don't we go ahead and get started? Good afternoon or good morning, depending on where you are in the country. Thank you for joining today's webinar on county innovations to end homelessness with NACo and with Community Solutions. My name is Nastasia Walsh. I am the Associate Program Director for Community Health and Justice at the National Association of Counties. We are very excited to have you here. Very important topic and something I know that all of you are working on right now. Many of you may know that homelessness was on the rise prior to the COVID-19 pandemic, and the pandemic's effect on the economy and on our families has led to an even greater housing crisis and a lot of struggles for our families. With the eviction moratorium ending and housing instability looming, county leaders are really looking for some long-term solutions to end homelessness in our communities. As the social safety net for our residents, counties are really uniquely qualified to connect families and individuals experiencing homelessness to not only housing, but also the services and supports they need to address some of the root causes of homelessness as well. So we have 3 new reports that I want to take the privilege of posting right now from NACo that highlights the county role in equitably improving health outcomes for residents and sharing strategies for addressing health equity, housing needs, and homelessness. So we will put the links to those reports in the chat for you, and we hope you'll check them out later. And then today with our panel, we've got a really great panel for you. Really want to share with you some actual examples of places that have been doing really great work in this space. So before we get started, just a reminder, the session is being recorded. We'll post it on the NACo website after the event, along with all of the slides. So you'll have access to those. Please feel free to use the chat box throughout the session. And we can answer those questions during the Q&A portion after our 3 presenters have had an opportunity to talk. So let's jump into the discussion here. I'm going to introduce our 3 panelists. First, we have Roseanne Haggerty, and Ms. Haggerty is the president and CEO of Community Solutions, which is an internationally recognized leader in developing innovative strategies to end homelessness. Community Solutions assists communities throughout the US and internationally in implementing systems that can measurably end homelessness and change the conditions that produce it. Their large-scale initiatives include the 100,000 Homes campaign and Built for Zero, and you'll hear a lot more from Roseanne about all the great work that they do. Next is Julia Orlando. And Ms. Orlando is the director of Bergen County, New Jersey's Housing, Health, and Human Services Center. Bergen County is one of just 2 communities in the country to end both veteran and chronic homelessness. So excited to hear from them. And then finally, we have Thomas Jacobs, who is the community liaison and care coordinator at Veterans Bridge Home in Charlotte, North Carolina. He's responsible for engaging with local human services providers to assist veterans to find appropriate resources within their communities and with their veteran services network. So thank you all so much for being here today. And I'm going to go ahead and turn it over to Roseanne. Each speaker will have about 15 minutes, and then we'll do Q&A at the very end, but feel free to put your questions in the chat as we go along. So Roseanne, I'm going to hand it over to you.
Thank you, Natasha. It's such a pleasure to be here with 2 of the great leaders working in the movement to end homelessness, and thrilled that Julia and Thomas can give the local story about how the work of Built for Zero is making progress across the country in measurably reducing homelessness. And we really appreciate NACo's commitment to this issue and to seeking solutions. And to actually start with probably a surprising statement in this issue, which is one about success. And if you could move to the next slide, please. Our work with Built for Zero now in 89 communities is very much oriented around believing and now seeing ample evidence that this is a solvable problem. But what we need to do locally and as a country is wrestle with the fact that it's not simply about housing supply. It's not simply about money, but it's about getting the right operating and governance systems in place to actually drive progress on this issue. And Natasha, if you could go to the next slide. Built for Zero is a movement that's now expanded to 89 county or county regions, really following the geographies of continuum of care entities. We now have 44 of those communities measurably ending homelessness, and 14 that have reached a standard called functional zero, which means that homelessness is measurably rare overall, brief when it happens, and that the COC, the local system, has essentially the capacity to keep staying ahead of the problem. That the big insight here was that homelessness needs to be approached and managed as the complex dynamic problem it is, and that solutions look like building a local team that is constantly staying ahead of it. We frankly, so much from the world of public health is relevant here, where the end state is being able to constantly solve and stay ahead of the problem, and to use data and deep collaboration as your new ways of working. And so how is this success coming about? Well, you'll be hearing from two of the great implementers, but let me walk you through how we got to this place, and really with an amazing group of communities around the country have learned our way forward into what works. So if we can go to the next slide, please, Natasha. This is probably a question that most of you county leaders are asking yourself in one shape or form around many of the areas of responsibility you have. But it is so vital in homelessness, because we could see even before COVID, well more than $12 billion was being spent around the country on emergency responses. But in no community could you really say, like, is everything that we're spending and all of the activity that we're engaged in and all of the programs we're operating, are they adding up to the thing that we really want, which is equitable reductions in homelessness? And I think many of us have felt trapped in this world of more and more programs, but fewer and fewer population level gains to show for it in the world of homelessness. And communities like Bergen County and Charlotte-Mecklenburg have been instrumental in really showing there is another way. And that answering this question and having it in front of you always, like, how do we make sure that all of our efforts are constantly adding up to less of what we're trying to avoid, people experiencing homelessness, and what would we need to have in place to tell us whether what we're doing is working? And so these are the driving questions behind Built for Zero, but I think you probably agree that they're relevant to questions beyond homelessness. And what we hope and believe is that some of the practice that communities are engaging with here is actually quite relevant to some of the upstream problems that produce homelessness. So Natasha, if you could go to the next slide, please. When we started down this road, we were also program operators ourselves. We built and operated an extensive amount of permanent supportive housing. But when we started stepping back and saying, why isn't it adding up to fewer people experiencing homelessness in our community? We began studying, why is this not all adding up to a response? And we saw that the fundamental challenge was that responsibility for the problem was distributed in so many places, different government agencies, different fields, different entities, none of whom had regular mechanisms for collaboration, many of whom were working with the same people, the same households, but without any kind of coordinated strategy, without any sense of what are the tools and the structures that would enable us to see that all of our efforts were adding up to an effective collective response. And this became sort of most painful when we kind of moved from this way of like mapping responsibility and how distributed it was to actually pulling groups of organizations and people in the midst of the experience of homelessness together to see how they were actually working. And if we could go to the next slide. This is essentially what we found. as we kind of went through this exercise in a number of places, getting groups together who needed to collaborate because some people held the rules, others had the approval, some had the money. There were process steps around access to available apartments and other eligibility requirements that had to be met and approved by different agencies. We found in community after community that this disaggregated responsibility was not just frightening to look at on paper, but imagine living it. If you were a worker, trying to get someone assisted and to avoid homelessness or out of homelessness, or worst of all, if you were a person, a vulnerable person, often with a disability, trying to figure out how do I get back into a home, that we inadvertently, in distributing all this responsibility, created conditions that made it almost impossible for what we all want is an end to this problem to actually be the thing we're focused on. That a lot of interim steps and different rules and distributed responsibility were standing in the way of progress, even with, in communities where there was an adequate amount of housing, you would still see these barriers. And so this became the project. And how we've learned over the last several years with the involvement of really courageous pioneering communities like Bergen County and Charlotte-Mecklenburg, we're prepared to learn in public how to get this right, is that thinking about this issue at a population level and at a very granular person level at the same time is the key. And what that really has required is a way of gathering and using data to drive decision-making and to create a shared understanding of the problem. And I think in the field of human services, data has typically been, like the thing you need for reports or that you're going to be judged on. But the power of having the right information for learning and improvement has really been at the center of the progress that Built for Zero communities are making. And let's go to the next slide so I can show you what this looks like. Most communities have been struggling with, at best, a once-a-year estimated count done in the end of January as their measure for what's going on in homelessness in our community. Well, in community after community, we have seen how just useless that is as a feedback loop to manage down a complex shifting problem that changes every day. You need information about what's happening every day, every week, not like a once-a-year estimate. And so, replacing this or supplementing, this snapshot approach with information that is timely, actionable, and in fact, can be disaggregated by race. So you actually know how different experiences and policies are landing on different groups, just became evidently central to a different kind of future. If we could go to the next slide. To get to a place where communities are working toward a collective aim, where are all of our activities adding up to what we want, which is less homelessness, we actually had to shift the incentives. That's why frankly the leadership of Bergen County and Charlotte-Mecklenburg are so exceptional and so urgently needed everywhere, which is to create mechanisms to shift activity and the measure of what is successful to how are we doing across the whole county, not just program by program. And so part of the learning that has happened in Built for Zero is to actually have a process for arriving at shared aims that are population based, not, well, here's a good program and their outcomes are better than another. It's actually, how's it all adding up? And places like Bergen County and Charlotte-Mecklenburg have shown how to get there with population level data and the real rigor around collaboration to get to collective outcomes. And these measures that Built for Zero communities use are very much around population level outcomes, and they correspond also, especially on chronic homelessness, with definitions that the federal government uses. On veteran homelessness, and on other fixed and dynamic populations, we find that what the end state looks like really matters a lot, and those definitions are crucial. And so Built for Zero communities have paid particular attention to those. If we could go to the next slide, please. Again, this is not a problem that is going to be solved by a good program. You need a really dynamic and committed community team. And so, here's back in the day when we all met in person, a snapshot from a Built for Zero learning session. These happen twice a year, and whole community teams come together to learn from each other because a lot of the challenges are common from one county to the next, but also to reinforce this sense that it's got to be government agencies, not-for-profits, landlords working together in new ways, housing authorities, the VA, all sharing their part of a common problem that needs to be tackled as a team. And just when you see this profound progress that communities are making, that's a signal that it's a strong team that's working beyond their program, beyond their agency, toward a collective goal. And reinforcing this sense of how a team can work toward shared aims has been very much part of this collective learning that we've done with all of these amazing communities. And next slide, please. And also, as part of this movement, we're seeing that, frankly, homelessness is one of those places where you can, as a community, take rapid, measurable, and life-changing action on racial equity goals. Right now, homelessness is shamefully disproportionately an experience suffered by Black and Native Americans. Having a tight, collective, data-driven, accountable framework in place is one of the places that your community can demonstrably gain ground on racial equity outcomes. Again, at the population level, not simply at the level of a good program. And if we can go to the next slide. Here's what the emerging future actually looks like and what communities like Bergen County and Charlotte and Mecklenburg have in place. They know in real time how many people are actively homeless. They know that homelessness isn't just a static problem, because they now have the data system that tells them who's new experiencing homelessness this month that has never experienced the problem before. Because you ask different questions. What happened? What were the catalytic events? That's how a community learns how to start being effective more and more at preventing homelessness. You can also ask questions like, if you return to homelessness after having been assisted in the past, what happened? What do we have to do and supplement next time to see that the housing placement is effective? And we're also able to capture who's returned to the radar screen, who had maybe attempted to resolve his or her or their family situation independently, that but didn't work, or maybe the individual was in the criminal justice system or in the healthcare system, but sort of off the radar screen of homelessness. For the longest time, we haven't been able to really account for what's going on there. And now, because communities have such robust data in Built for Zero, they can see these patterns and understand that homelessness is far too big a category to be actionable. You have to really get it down to the level of what's happening in individual lives and how to tighten up local safety net systems to prevent those problems from happening and to learn to resolve them quickly. Data is the key for that. And you're also able to look at it, and what community teams are looking at constantly together is how do we accelerate our housing placement rates, and keeping track of folks who may be resolving the problem on their own or moving off the active screen, so that you have a complete dynamic picture of a problem. I think, again, in almost any complex area, if you don't have a comprehensive real-time view of it, you're just guessing what's working. You're just guessing what's going on. And we've replaced that in Built for Zero communities with this crisp, robust information that is shared and that a whole community team can look at to have a shared reality about what's happening and what we need to do next to change it. Next slide, please. This system level problem solving is again, such an important innovation. The idea that you're not just adding up the different activities of programs, but you're looking as a community team at like what the overall pattern and trend is and how you interrupt that, and whether the numbers of individuals population by population are moving up, moving down. You can pick apart your data, and I'll just give a shout out to the Tableau Foundation, who donated their time to help us build this new system that Built for Zero communities use, that allows communities to really visualize and track system level outcomes and progress, and to zoom in on different data points to see whether the part of increases or decreases relate to new inflow or what part of inflow. This dynamic system can now be visualized, and it makes it easier for groups from different organizations to actually share a common truth and understanding of the problem and how it's moving and changing. And if we can go to the next slide. And I referenced this a moment ago, having this visualized data allows you to zoom in on whether you're getting your inflow down, whether you're accelerating your outflow, and what events are happening that create the most promising or worrying, flagging the worrying events that can enable a community to quickly adjust their strategy and their interventions. Again, the fluid data, the dynamic data is what is really breaking open a new understanding and practice around responding to homelessness in built for zero communities. And these tools have proven to be enormously effective. Get to the next slide, please. And so as someone who started this work as a houser, as a program person, it's so interesting for me to reflect, our journey and the journey of so many communities now that are part of this movement has really been from understanding or believing homelessness was just a housing problem, or we just don't have enough of this resource or that resource, or maybe it's individuals who are choosing this lifestyle, to a profoundly different understanding of what a community needs to have in place to actually get ahead of and continually solve a solvable and urgent public health and racial equity challenge in this case. And these are the building blocks. Having a shared aim across all of the critical actors in the community, having that nimble integrated team of the government agencies, of the continuum of care, the VA, the housing authority, having real-time by name information about what's actually happening to drive collective decision-making and to consistently reinforce improvement and create the insight into what's working and what isn't working, whether everything is adding up to a reduction in homelessness. And then within the Built for Zero movement, it's been, I think, just an incredible atmosphere of generosity with all of these communities being part of capturing case studies about what is working in their communities, making their experience available to others in this very rapid and generous peer learning network infrastructure that we have. And then in this context of a robust, accountable, data-driven system, communities can finally see what part of the problem really is housing supply, really is a missing resource, and can make investments in the most targeted and effective ways. Again, it's not just housing, it's the system, it's both. And we've been so grateful to work with leaders like Julia and Thomas, as you'll hear, who are implementing this practice on the ground and really carving the path for other county and regions to follow. So with that, let me turn it over to Julia.
Thank you so much, Roseanne. Having been started my career in New York City in supportive housing, alongside you, and you being the gold standard for work and for how work gets done, to be part of your communities is such an incredible privilege. So thank you so much. So let's get started. Can you advance the slides, please? So just a snapshot here of who we are here in Bergen County. This is our COC. It's 32 countywide providers. And this creates the solid foundation for which we work amongst our homeless services. Our focuses are, of course, precariously housed, at risk, homeless to permanently housed, and in need of services. So it is this robust collaboration that Roseanne was speaking to that really has brought us to the place that we are today. Next slide, please. So how it began, over 35 years ago, Bergen County initiated efforts to combat homelessness. We had some temporary shelters that were open on East Kansas Street. And mainly it was our churches, nonprofit agencies in the forefront of the delivery of services for people experiencing homelessness. And despite all of these excellent services, they found that homelessness persisted and there needed to be a more comprehensive, coordinated approach to the work. Next slide, please. This is just a timeline just to kind of take you through the process that Bergen County went in this transformation. So in 2002, there was an analysis of our existing services. The county had 200 stakeholder interviews that were done across the county, asking people who lived and worked and served in the community, if we were going to change our response to homeless services, what do you think it should look like? So everyone had input and buy into that process, which I think is such an important component of this work. In 2006, the county develops a 10-year plan to end homelessness. That plan rolled out in 2008. 2007, we have the county collaborating with the United Way to develop a pilot of the work that we were setting out to do, to take a look if a housing first model could be successful in our suburban environment. In 2007, also our HUD funding was aligned with the county funding, and the plan to build a one-stop center came to fruition. And in 2009, there was the completed construction of the, which is now known as the Bergen County Housing, Health, and Human Services Center. Next slide, please. So just taking a look at the difference between what it looked like then and what it looks like now. Before, as in many communities, we had multiple locations, including trailers that were used to shelter folks during the cold winter months, and one that was all year round. In many of these places, people with substance uses were banned. They were difficult to access. There were 4 different intakes, very limited access to housing. And very troubling to me personally is that in a county of close to 1 million people, there were only 8 beds available for women. So in our newly revised system, we have one newly constructed location. We're open 24 hours, 365 days a year. We're what's considered a low barrier, meaning that if you're a person experiencing street homelessness, it's going to be very easy for you to get into shelter, very easy for police to bring you to us. We also now, use a coordinated entry system. We prioritize immediate access to housing, and we now have over 45 beds for women. Next slide, please. So this is our magnificent, beautiful facility that includes our homeless shelter, also our feeding program. It also provides access to services that anyone who is precariously housed or homeless can find the services they need. I think what's so important about the facade of this building is that initially when it was constructed, you would hear people talking about how nice it was and kind of surprised how nice it was. And, if you're looking to have people come off your streets, they're not going to want to go to some place that's broken down and unsafe and not clean. They're not going to want to go. So I think the fact that there was a lot of care given by the County of Bergen to the way that this building looks was such an important component of our outcomes truly in the work. Next slide, please. So this facility is a shared project between the County of Bergen and the Housing Authority of Bergen County. I'm an employee of the Housing Authority of Bergen County. And the shared mission really is to end homelessness by providing a full continuum of housing services. We know that the things that work in this space include a housing first platform, having a one-stop location and a single point of entry, having, we have 90 shelter beds, 72 now post-pandemic, providing nutritional programs, meals, not only to people experiencing homelessness, but also to the working poor in our community, and anybody who needs a meal can come get a meal every day for breakfast and for lunch. For lunch and for dinner. We have showers, laundry, storage, because that's another important piece. People experiencing homelessness, if they can't bring their belongings with them, will not come in for shelter. So having that space here is very important. We also have nurses on site, and very important, having flexible office spaces for our collaborative partners. So being able to be a satellite office for the group that does the welfare, the group that does veteran services, the group that does the mental health screening. All of those providers can work in this one facility, truly at no cost to them. So there's a lot of incentive for our partner agencies to come on. I see a question, are there accommodations for animals here? We will allow a service animal to be kept on the premises. We do not have the capacity to provide shelter for therapy dogs that are not service animals. What we do is we do have an outstanding shelter for animals, and they can board the animal and be well taken care of while we're working on the housing for the person to be reunited with their pet. We have found that to be very successful in our community. Next slide, please. This is some of our sources of funding. We have our federal funding, CDBG, ESG, Home, and FEMA. Especially in our early years, HPRP funds were key in the work that we were doing. We also have our state funding, our SHUSH dollars. We are one of the communities that is immensely fortunate to have a homeless trust fund. And also we have philanthropic dollars that come into our program for unmet needs. Next slide, please. So I've talked about low barrier and housing focused shelter. Really what it's about is making sure that the people who need to get into your shelter, people that are on the street, are getting in first, and that everyone else we're doing diversion for. We're trying to keep people really not in shelter unless they absolutely have to be here, but we attach everybody to housing as long as they meet the criteria for homeless or at risk of homelessness. One of the most important things that I do here is setting and holding partners accountable. That's a very big piece of the work that Roseanne was talking about, making sure that all of your collective agencies are staying, having fidelity to the goal of ending homelessness. And what Community Solutions brings to the table is that sense of urgency that, you know, if a community doesn't have a sense of urgency, people don't get into housing or into shelter as quickly as they need to. Next slide, please. So we do coordinated assessment here. We do use VI SPDAT, but we have a modified version of that that works for our community. And we do have what's called an HPL, Housing Prioritization List. So we know every person in our community experiencing homelessness, whether they're singles, families, domestic violence, youth, by name on our list, by their vulnerability index, which can be a fluid identifier in our community that can change over time. And that list, anyone can send in an application for someone to be added to that housing prioritization list from the hospital, from the jail, from the community, from a church, anywhere in our community that can be brought to us so that we can add those people on to access services. Next slide, please. This is just something that we do that's really important is no matter what happens in our shelter system, because a lot of times in shelter, there's distractions, people's behavior, other kinds of things going on. We talk about housing from the moment the person comes into shelter. We're constantly asking, what's your housing plan? What have you done today? What else do you need to do? Do you need to go to welfare? Did you apply for Social Security? Did you fill out this application? Did you meet with the housing navigator? Whatever it is, our role here is to make sure that this is the focus always of the work that we do. Next slide, please. So this is just a snapshot of the services we have here in our community. We have our case management services, our stabilization resources. We also have community engaged landlords, and everyone works from this centralized housing prioritization list. Next slide, please. So this is one of my favorite pictures from our Built for Zero. Everybody in this picture actually has met a functional zero for something in their community. And really what the slide is for is really to drive home the importance of collaboration. And to understand that collaboration doesn't always mean you agree or that you even get along or maybe don't even like each other. That is not what collaboration is. Collaboration is learning how to bring all of our resources to bear to this shared vision. Next slide, please. So we have this culture of collaboration, and the building itself was designed so that collaboration could happen. I don't have to spend hours trying to get people on a phone. Everybody I need is in my building. I can just walk down the hall and go see somebody from the Board of Social Services. I can walk down the hall and speak to the nurse if I need to. So we can get things done in real time because we are all collaborating and working together and constantly communicating. Next slide, please. So a very important part of this work and our success has been the role of the Housing Authority of Bergen County. So we provide the management and administration of our center. But the Housing Authority of Bergen County provides set-asides and prioritization in their administrative plan for people that are homeless. So yes, we can bring housing resources to bear here in Bergen County, and many people think that that's the reason we've ended homelessness. And it is a major reason we've ended homelessness, but it's not just having vouchers and not just having subsidy. It has to do with all of those services working together, which I think is what Roseanne was pointing out in the beginning, that we've learned over time. It's how we work together and not just what we're bringing to the table. Next slide, please. This is from one of our Community Solutions conferences. This is one of our partners, Mary Sundin, who's the data lead. She's the one doing all of that math on a constant basis, making sure that we are providing our deliverables. And Mary runs the Christchurch Community Development Corporation, and they provide our shelter operations in our collaboration. Next slide, please. So this is our hospital, our county hospital. I actually serve on the board of this hospital. This is an amazing partnership. This is a county hospital, but the collaboration with them makes sure that nobody leaves that hospital without we confirming that the person is coming for shelter, has a bed available, has linkages to services prior to discharge. No one is just leaving that hospital into homelessness. We are working together every step of the way. And this is such a critical partner, this healthcare partner, especially in a pandemic, because we've actually been able to provide vaccines on site for people experiencing homelessness. And they're more comfortable getting them here than getting them in the hospital. So that's been an incredible partnership. Next slide, please. This is our county executive. You know, Roseanne was talking about this. Community, you really need to have political will. Political will is the foundation of why we were able to have the services we have, why we were able to get to functional zero, and why we've been able to stay at functional zero. It has been this political will and the commitment of our county officials to sustain this work and to prioritize this work. So this is our county executive, Jim Tedesco, actually signing something that's proudly in my office, which is a picture of all of us when we reached functional zero for chronic homelessness. Next slide, please. We also have our local government, our mayor. It was very important. Our mayor signed on to our mayor's challenge, has continued to be a support to us because our shelter sits within our county seat. So this relationship was very important, and they continue to support our efforts, and we continue to care for the people in the city of Hackensack. Next slide, please. Also, our business partnership in Hackensack was a very important relationship. They also provide jobs to our folks here in shelter. I meet with them quarterly, and I have for 12 years. Every quarter, I meet with them to make sure if there's any concerns in the community, they're able to share with me what things we need to be taking a look at, and I can call upon them to also support our efforts. Next slide. And I just want to say about that, since we've ended chronic and veteran homelessness, as you can see in this slide, the city of Hackensack has been revitalizing. They have about 7 or 8 large, very large housing complexes. They have literally seen the revitalization of their community. And if you ask them, they don't see people sleeping on the streets of Hackensack like we saw, 10, 15 years ago. We have really changed the way that the landscape of Hackensack has looked. And if anybody's in Hackensack and they need trouble, they can always call us. You can see here our outcomes. We reached functional zero for chronic homelessness and also for zero. So we are one of, I believe, only 3 communities that are what's called double zero. Last slide, please. This is actually a picture of myself with the county executive at the White House when we ended veteran homelessness, one of the greatest days of my life. and a letter from Michelle Obama inviting us and thanking us for our work. It was an outstanding experience. And the next one is our last slide. And my time is up. And this is just the list of our government leadership here in Bergen County. You can see our county executive, our board of commissioners, and the head of the Housing Authority of Bergen County, Lynn Bartlett. That concludes my presentation. Thank you. And I believe so the next speaker is Thomas Jacobs. There you are.
I appreciate it, Julia. I appreciate it, Roseanne. And wow, that is a tough act to follow. Both Julia and Roseanne, they're doing great work. I'm glad to be a part of it. We're fairly early in this, in the Built for Zero movement and the things that are being done within the veteran community. My name is Thomas Jacobs. I am the Community Care Liaison Care Coordinator at Veterans Bridge Home. Veterans Bridge Home, we're a local veterans nonprofit that helps veterans connect with local resources. Kind of the hodgepodge image that that Roseanne put up earlier. This is something that we knew was in our community. I'm a veteran myself, a 5-year Army veteran here in the local community. And a lot of the team members that I work with, they're all veterans as well. So we understood that hodgepodge image that came together. And that's why Veterans Bridge Home was created. And that's where the name comes from. We help bridge the veterans between themselves and their home community. Next slide, please. So Veterans Bridge Home, we are the quarterback agency for veteran services in the community. The community as a whole is one of the 80 plus communities that are working to end veteran homelessness in the area. We got involved back in 2018, and we reached our quality data by name list back in December of 2018. Since then, we've been able to reduce the numbers by over 35%. My teammate, we've always had someone from the Veterans Bridge Home team involved because we knew we had to be that quarterback agency helping the veterans in the community. It would make no sense to have someone else leading the charge to help veterans with the homelessness problem without having somebody from our team. So my teammate, he got involved early in the process, and he helped lead us until last year, when obviously the pandemic kind of shifted a lot of people's responsibilities. I was working with him prior to that, but I wasn't as involved, but I did follow in behind him. And I tell you all of this because that talks about some of the things that'll go on later in the presentation. And we were very intentional about how we did certain collaborations. So as my counterpart was helping lead the movement within the Charlotte-Mecklenburg community, along with other community partners, he was helping groom me to one day possibly help be in his role while he was still there. Now, during the pandemic, he started off at the beginning of it. Our numbers did start to rise, just like a lot of the other communities as well. But we saw it was still seasonal. But the numbers still rose, but they dropped during the warm season and then started to go back up. In September of last year, my teammate, he had to step away for responsibilities due to the pandemic, and I took over. Within that first 6 months, I saw a 30% rise in numbers. So it was a little unsettling, but we knew we had to lean on the guidance that we were receiving from the Community Solutions team. And that's where we were able to kind of say, hey, let's see what works. And so our goal for this year at the end of 2021 is to see a 30% reduction. And we are moving towards that. And we do anticipate seeing those numbers move towards 30% reduction so we can continue our path to functional zero. Next slide, please. So some of the key solutions that we learned along the way was agility, being nimble and being agile whenever we come to decision makings. We knew we had to collaborate. We knew nimbleness was key, and we knew we had to work amongst all the community members within the area. Some of the key members were going to have to be the Veteran Service Office, which is our local Mecklenburg County VSO, as well as the VA. We knew we had to have them involved, and we knew we had to not only have them at the table, but we had to have them actually involved. One of the parts of the nimbleness as well was also adjusting to the changes that we saw in the numbers. A lot of times, just with anything in life, we see data and we just kind of get stuck in our ways. One way that we put out at the beginning, we don't want to change. We knew we had to change as the data in our market changed. And we were willing to do that and try out new techniques as we saw the data presented us new options. The best solution that we learned along the way was depth and collaboration. We knew we had to talk about, we knew depth had to be a key part of what we were doing in our services. And that goes along with my team, my counterpart who was leading the team before, transitioning over to me. Next slide, please. So some of the keys to our success here locally was having the local government. So not only did we have the Veteran Service Office, we had our whole Community Support Solutions team. So that means everyone within the homelessness space, as well as other areas like domestic violence, the shelters, all of those that are under the government umbrella in the Community Solutions, Community Services Department, they were all involved. We had to have buy-in from them. This also meant them running it up the chain to local elected officials like the mayor, the county commissioners, all of those were involved as well. Another key, I stated earlier, the VA had to be at the table. Not only did they have to be at the table, they have to be involved because they're the ones who are going to be able to tell you, what programs are current, what the requirements are, what the numbers look like. The big program that everybody knows about is HUD-VASH, which is the VA equivalent of like a Section 8 voucher, but it is a housing choice voucher. We had to have them at the table so they could tell us what the process is, what the numbers look like. Do we need to, shift how we do things? This was critical. That was so critical. Another key was the agility. We knew we had to be very agile in our decision making. And like I stated earlier, the data had to drive what was going on. And the last key, and probably the most important key, and that's why I saved it for last, was the depth in collaborations. And what that looks like is my teammate, he was leading the charge, but I was also involved as well. So anytime that somebody was working to connect somebody with Veterans Bridge Home, they weren't just working with my teammate, they were working with me as well. So I was included in all of those communications. And whenever I reached out to other teammates at the shelter, at the VA, I wouldn't just reach out to one person, I would reach out to multiple people because we all know that in this line of work, people change positions, people change organizations, they leave, they go. So we knew we couldn't just be working with that person at the organization. We knew we had to be working with the organization as a whole. So the biggest key to our success so far in the only less than 3 years that we've been doing this is making sure that we have that depth and collaboration. And if Thomas needs to speak with someone over at the men's shelter, it's not just going to be the one person that I have the best relationship, is that I can reach out to one of 2, 3, or 4 different people. So this veteran, every day that a veteran is homeless, that's a problem. So anytime that somebody we want people to be able to kind of step away from the work and decompress and take vacations. So we don't want that veteran to stay homeless for 3 or 4 days while someone goes on vacation. And that's why it's key across any community to have that depth. So you can make sure that if someone does need to change position or move away or do something, you have another point of contact to be able to move forward. That concludes my portion of it, and I will hand it back over to, I believe it was Nastasia.
Great. Thank you so much, Thomas. And thank you, Roseanne and Julia, for your presentations. Lots of really great information here, of course. Want to open it up to Q&A as well. And I know there's been some back and forth in the chat. But one of the first questions, and I think, Roseanne, you just typed this out, but would love if you want to talk a little bit about how some of our federal policymakers can catalyze some of this systems level problem solving, how this is sort of a model, if you want to elaborate on your chat.
Sure, and it's a great question from Marguerite. This is really, I think, at the nub of what communities struggle with that the resources they receive from the federal government tend to reinforce silos and also program level outcomes. And so it's very much in our collective kind of policy interest to really press for a different measure when the annual notice of funds availability comes out. Yeah, like our communities being rewarded for achieving population level reductions, and that really has to be centered. That incentive to collaborate can be incented in federal contracting. Also, the role of having the right data, the right information. Both Julia and Thomas spoke to how game-changing this was. To supplement the existing data requirements, which are inadequate for this kind of problem solving, the federal government should set new data standards that require communities to collect and maintain and use by name, real-time data on those experiencing homelessness, and in a format that the organizations who need to collaborate can easily access in a HIPAA-protected environment. And then the federal government should resource that. That this is probably some of the best money that will be spent, because it will see that people are actually reached and helped out of the funds that are coming out, as opposed to the communities never having a good handle on what's working. And so those three things, incentives that are baked into the federal contracting and notice of funds availability, new data standards that really support the urgency of this work being done and being done in a collaborative way, and providing the resources for the system management, not simply program support.
Great. Julia, Thomas, any additional thoughts on that question for our folks?
I think what's really important, and again, I'm going to say this again, when we joined Community Solutions, the two things they taught us was, number one, the language about vulnerability. So for example, when I was running, when I was started in the shelter here, and I had one bed and two people who needed the bed, my question would be, well, if one of them, if they both stay outside, who would possibly die? That was my metric for deciding vulnerability. And that's how we decided. Of the two people, not the person who got to us first, not the person who made the most noise, it was the person who was most vulnerable. So I think learning about vulnerability and people recognizing that we are talking about life and death with people being left outside, it is that serious. And then the second thing is this sense of urgency. I think tragically, who's holding everyone accountable? For me, if I'm not doing what I need to do, people have a place to go and complain, or I'm always being held accountable for everything I do in my work. It's very transparent. And if I'm not sheltering people, or people are on the street, or people are not getting into housing, there's an accountability there. So I think what Roseanne's talking about, we have to build in some kind of accountability for people who are responsible to care for people who are most vulnerable. And we don't do that. The people who are part of Community Solutions voluntarily open up their books and open up their work and say, judge me and change me and help us do this better. I don't know that all communities welcome that. And I think that that is important in this work if we are going to really move the needle on homelessness and make sure that the right people are getting into shelters, that the shelters are getting people into housing, and that we're getting people off the street.
One thing I'll add to that is understanding the data and understanding the programs that you already have in place. Using those programs to explore the gaps in the needs. And that will help push like the policymakers to say, hey, this is what we're already using and we're coming up short. So this is where we need extra. This can help push them to develop policies to provide extra funding. And also, like Roseanne said, it has to be a rewards-based system. Who's doing what? Who's involved? Who's at the table? Who's driving change? Well, if they're driving change and they're not there yet, they do need some assistance to help get there. And that will help, that data will help provide that.
I just want to say one last thing is when we ended homelessness for one of our categories, one of the agencies actually got very upset and was under the perception that their funding was going to end and that this was a bad thing that we did. And I remember being very surprised by that reaction. And what I found is that if you're doing the right thing with your money, right, that you're going to continue to be funded. It's quite the opposite. But I think that is a fear among some people that, you know, if we get to functional zero, is the perception going to be, we don't need funding, we don't need help. And that's really important for communities to know that it's absolutely the opposite of that, that people are going to want to give you money because they see your outcomes. They see that you're meeting the needs. So I think that's just something I wanted to point out.
And there's been some discussion in the chat, and there was a question around, can you use your American Rescue Plan dollars for shelters? And appreciate Andrew Stanley jumping in on this, that you can use them as a response to COVID. We have seen some of our counties who have used it for emergency situations, for things like domestic violence, opening up more domestic violence shelter beds for people who, I know there's been increased domestic violence cases as a result of COVID-19 and the pandemic, and so doing that. But also appreciate the comment that that's not necessarily a permanent solution. So I would encourage people, and I'll put in the chat, to NACo's website on COVID-19 and the American Rescue Plan and state and local fiscal recovery funds has a lot of really, really great resources and county examples of how counties are using some of those ARP dollars towards housing and shelters. And so I'll put that link in the chat as well. But I don't know if any of our panelists wanted to comment on that question too, or any way that you all are using any of your American Rescue Plan dollars to help with some of your efforts.
Well, I'll just say
our community hasn't voted on it yet, so we're still kind of waiting to see what the community vote and decision is going to be. So we're still waiting to see what the ARP funds are going to look like.
We just got our grant award last week. That just came through. So I know that we are in the same position as Thomas. I think that, you know, there has to be, they still have to meet and vote on that. But, you know, my personal hope and expectation would be definitely housing. We have a very terrific, it is a congregate shelter. These funds really should be for non-congregate. We did use motel placement during the pandemic, but it's yet to be seen until the vote. I really can't say for sure how we're going to be using that money yet.
And I'll just add that, you know, these unprecedented resources, what's been so exciting is seeing so many Built for Zero communities to say, let's use this to really build for the long-term shift we're looking for, not to just reinforce a culture of emergency reaction. And so that's our message everywhere, you know, just, you know, use this extraordinary opportunity to really solve the problem.
I know there was a couple of questions maybe for you, Roseanne, and for your team. I know some of your folks have been jumping in, but which counties have achieved the systems outcomes for Built for Zero, and then how do you join Built for Zero? Were a couple of hopefully quick questions in there, because I know we just have a couple of minutes left, and I have one more question in the chat too.
Sure. I'll say just among the counties who are just rock stars here, in addition to Julia and Thomas, who's seeing such incredible progress, the actual functional zero counties include Bergen County, Montgomery County, a whole 6-county region in along the Gulf Coast of Mississippi. We have, let's see, I think Norman, Oklahoma. I'm not sure it completely aligns with the county boundaries. Kern County in California, the Bakersfield area, they've achieved functional zero for chronic homelessness. There are a number of counties in Colorado have either achieved functional zero or close, several in Virginia. So that's where, you know, we see incredible leadership. But I also, there are those 14 communities that have achieved functional zero. We are so excited about these communities right behind them, like Charlotte Mecklenburg, which are, in very tight housing markets, rising costs, just pushing through and showing, the power of collaboration and actually the power of data to tell you where to make your next investment. And then joining Built for Zero, you can go to our website. We are probably we're at 89 communities now with another 11 joining this fall. We are probably going to cap the communities at about 110, so we can just go deep with that number of communities and put equal emphasis on the policy shifts needed. We just feel that the moment is now to both demonstrate that homelessness can be solved anywhere in any type of community of any size, and to lean into the policy barriers that get in the way of any community, whether or not we're working directly with them solving this problem. So, your county, we'd love to hear from you and walk you through what the commitment would be.
Thank you. And I saw more information in the chat as well. I have one more question. Hopefully we can get a really quick answer because I know we're right at time, but I think this is an important question. The question came in, it came into the private chat, but is about residency requirements. So a lot of folks are living on the borders between multiple counties or a county and a city, and their residency, whatever that means on their ID, says that they live in one city, and so they're not able to access something that maybe is like a mile down the road. How are you guys addressing some of those barriers of residency requirements, or do you have those, whether it's for short-term or receiving some long-term services as part of your efforts? That was framed well for you.
So I'll jump in because Charlotte is right on the border of South Carolina. And we do have that issue where a lot of people will work in Charlotte, but they live in York County, South Carolina, or Chester, South Carolina. So what we've done, we've expanded Veterans Bridge Homes coverage into that area. So we've established relationships, and we have a dedicated care coordinator like myself in Charlotte that's now down there who has established relationships there. So it really depends on their situation as, are they looking to move into the Charlotte area? Or are they like, where is your home base going to be? And that's where we will put the focus on trying to determine what are you looking to accomplish? And that's how we determine it. If they're living in the South Carolina area, we put our focuses and emphasis for resources in that area. But if they're looking to be in Charlotte, we look for the resources that are here in Charlotte. So it really depends on what their ultimate goal is, because we also believe in self-determination. We don't try to force them to the resources. We want them to make the determination of where they want to be, because that sets them up for success in the future.
So for us, we actually look at last permanent address. And we work very closely with our Board of Social Services on that. What we have done with the board is they have done immediate need with people. So for example, if you lived in northern New Jersey your whole life, then you moved down to southern New Jersey for a while, and then you want to return, the Board of Social Services can do something called immediate need and help people. And that allows us then to shelter them here and work with them on housing. So I think it's really about working with your other partners to help people identify where they're best served, where their families are, where their work is. I think it has a lot to do with just approaching this work as one person at a time. And I think that's hard in very large places. And Roseanne, you have some of the larger cities that you're working with, but I still think that there's some truth to that, really working with a person individually on really what's going to work best for them, where are they going to be able to access services, and where are they going to be best served.
And another thing, just to tag on to what Julia said, it's also where do they have a good support system? That's another area that we look at. We want to look at their support system. If they have a stronger support system in one community, we want to try to talk to them. We still want them to make the best determination for them. But where can you get support holistically, not just focusing on the housing piece, but you're going to need emotional support once you do get established or start to move towards stability.
All right, guys, that's all the time we had for today. I really want to thank everybody for your questions and engagement, and thank you to our speakers. You guys are just really inspiring, and it's really great to hear some solutions. We know that this is a solvable problem because folks have done it. And so hearing the stories and hearing about how you did it and how it's, it's not just one agency, it's not just one person, that it's a really group effort is really great. So thank you again for our speakers. Again, as you all see in the chat, we are recording this. We'll post it on the NACo website for you to view. We'll post the slides, and then I'll also email out everybody who registered and attended to make sure that you have our speakers information and our slides as well. So thank you everybody for coming. This concludes our webinar. Have a great rest of your week.
Thank you.